Welcome to this video presentation demonstrating a Firstsign 7-in-1 drug panel. Firstsign is manufactured by WHPM Inc. It's a Chinese manufactured piece of biotech. The parent company is a Californian American holding company. This panel screens for combination 7-in-1, which includes on this particular combo amphetamine, benzodiazepines, cocaine, methamphetamine, opiates, methadone and cannabis. On the reverse of the foil you've got what it is, a 7-in-1 dip card, 4mm membranes, a lot and expiry date. Now to perform the tests are very easy. It's a standard test procedure. When you're ready to do the test, remove the test from the foil. This one comes with two desiccant pouches just to keep the foil dry before you run the test. And the format on this particular test is 4 on one side and 3 on the reverse. When you're ready to perform the test, note your timings. Remove the cover. This exposes your prongs coming from the bottom of the test panel with dots indicating the fluid levels. The dip line, maximum dip length, depth here is the bottom of the test panel. So you don't want to actually put the test panel into the urine sample. You just want to put the prongs in. So I'm just going to dip that off camera into a sample, and basically this just needs to be dipped for between 5 and 8 seconds. You can usually see when you've absorbed sufficient urine, you start to see the pink colour running up in the test windows. When you've completed the dip, just reinsert the cover, and that basically just means that there's no urine on the prongs to contaminate your work surface, so it can be placed on a flat surface. And now you see that pinkish dye running up through the control and test line areas in the center portion of this panel, and you'll see starting to develop your control and test lines. Now the codings on these test panels basically are shown in these windows. So you've got THC for cannabis, meth amp for methamphetamine, AMP for amphetamine, MOR is the coding. Sometimes it's coded MOP or MOR. That usually indicates a 300 nanogram opiate membrane. And on the reverse of this one you've got BZO for benzo, COC for cocaine, and methadone actually written in full as methadone. So if we just show you some of the results coming up on here, you're looking for the presence or absence of a control line. That has to form for the test to be valid. Without a control line you must repeat the test because it's an invalid test result. And to read the result you're looking for the presence or absence of a test line in the presence of a control line. So if you've got 2 lines, that's a negative result. If you've got a control line but no test line showing at the indicative period, that's a positive result. If you've got no line showing at all, that means insufficient urine's been absorbed. Now if we just show you the results on this one, we've got all control lines and all test lines showing at around 2 minutes. Clear negative results for those 4 membranes. On the reverse again we've got control lines and test lines showing all at 2 minutes. No need to wait for the full period of development on this test. They're all negative results. You can move on to the next test. If if the control lines were present but there were no test lines developing, that would indicate the possibility of a positive result, but you should give it the full development time before interpreting that as a positive result. And the test line, even if it's very thin or very faint, if it's barely discernible, you must still read that as a negative result. The presence of a control line. So that's the Firstsign one-step drug of abuse test manufactured by WHPM. This is demonstration of the 7 panel, and there we go, nice clear test results.